Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. Vasospasm is a very painful condition that affects many breastfeeding women. Today we'll be talking about everything you need to know about vasospasm and how to treat it. So click those like and subscribe buttons and stay with us. Vasospasm is the constriction or tightening of blood vessels. It's often misdiagnosed when it happens in the breast as thrush. Vasospasm can be very painful, and it's a lot more common if you have a family history of Raynaud's disease, poor circulation, cold fingers, or a low body mass, otherwise known as being way too thin. Vasospasm is very painful. It's a sharp pain or a burning or stinging sensation in the nipple. When blood flow returns to the nipple, you may feel throbbing or numbness. The pain can occur during your feeding, but it usually occurs afterwards when the nipple is exposed to cold air. Your nipple may turn white and then blue, purple, or red before returning to its normal color. And these symptoms can last for a few seconds to minutes or even longer. Nipple blanching is sometimes mistaken for vasospasm. You'll notice this after your baby delatches. The nipple is usually whitened and has a lipstick shape. There may also be a white stripe across your nipple. This occurs because the baby is latched too hard while feeding and they compress the nipple. Please remember to hit the like and subscribe button so you can get our latest content. There are a couple causes of vasospasm. First of all, and most commonly, is nipple trauma, which is usually caused by a poor latch. Your baby usually isn't deep enough, but instead is shallow on the nipple. A fast milk flow can also cause this nipple trauma because the baby clamps down on the nipple to control your breast milk flow. Pump trauma is the third cause of nipple trauma, and this is usually because the flanges that you use to pump the milk are too small. Additional causes of vasospasm include exposure to the cold. You may also notice symptoms in your fingers or your toes when they are exposed to cold. There are many things you can avoid with a vasospasm that may help. For starters, you want to avoid nicotine, caffeine, and sports drinks, which can all contribute to vasospasms. You want to try to avoid a poor latch, so get some lactation help to evaluate the baby for tongue tie and palate issues. Also, have a lactation consultant check your pumping and make sure you're using proper technique and that your flange size is okay. And finally, you want to avoid cold air, so air drying your nipples may not be good for you. There are some things that you can do to help treat and manage your vasospasm. The main thing is to keep your nipples warm. You can start to do this by wearing an extra layer of clothing or even use wool breast pads. Breast warmers can also be purchased and used on the breasts to help keep them warm. If you're going to take a shower or get dressed, try to do that in the bathroom and warm the air prior to exposing your nipples. There are some medications and supplements that you can use for vasospasm. If you're having pain, you can use Tylenol and ibuprofen. Calcium channel blockers may be prescribed by your healthcare provider. This includes nifedipine, and what that does is it helps to dilate the blood vessels, preventing the vasospasm at all. Fish oil capsules and evening primrose oil can help to relax your blood vessels. Other supplements that can be used are magnesium, vitamin B6, and calcium. And finally, olive oil can be massaged onto your nipple to help with some of the pain. I hope this video has helped you learn everything you need to know about vasospasm and strategies on how to treat it. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest information on pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those into the description below. Thank you so much for joining us at the Maternity Mentor.